Hello, today I'm gonna talk about redefining ASD. So, first of all, what is ASD? ASD stands for Autism Spectrum Disorder. It is known as a neurological disorder. Well, many people, especially parents, might misunderstand it as a behavioral disorder. Because what we observe from children with ASD, there are all kinds of behavior deficits. We use the term spectrum here is because that speaking of ASD, there are many different kinds of appearance. Every one of them is a unique individuality. Also, it's a phylogenetic disorder because there are multiple etiologies, but many autism children express themselves through common pathways. According to the latest version of autism diagnosis criteria, which is DSM-5, people with autism must conform with the following 5 criteria. First one, persistent deficits in social communication and social interaction across multiple contexts. Second, repetitive patterns of behavioral interests or activities. Then, symptoms must be presented in early developmental period. Also, symptoms causes clinical significant impairment in social, occupational, or other important areas of current functioning. The last one, these disturbances are not better explained by intellectual disabilities or global developmental delay. For parents, there are lots of common resources we can looking for to help our children. The first one is home intervention, and we have clinic interventions, biomedicine interventions, social interventions, and other social supports. But the most important one here is home interventions, because we consider children spend most of their time at home with their parents or caregivers. So let's see, what do we parents usually expect if we do all these kind of interventions? Parents usually, we usually looking for childrens to have increasing in language skills, cognitive abilities, also maybe pronunciation skills, sensory issues, attention ability, social communication skills, and the behavioral and the emotional issues. But let's think again. Are these enough for our children? So today I'm gonna bring you a new idea of the 5 core deficits of ASD, as we can see here. The first one is dynamic appraisal, which means we should think and making decisions in a dynamic way. And in fact, many of the autism childrens, they think in a static ways because of their special brain structures. So the first one is very important, and many parents have already agreed with this one. The second, autism children lack of self-awareness, which means they can't, every time they think of a situation or a thing, they can't connect their own feelings or who they are in that situation. And then the episodic memory and the experience sharing, because the lack of self-awareness, of course, they don't have this kind of episodic memory. They only, in their memory, maybe they can only remember the things like what's the color of the train, or what do they eat on the train, or maybe what do they maybe wear during the trip to the Disneyland. They can't have this, like they feel very happy or they feel sad, this kind of episodic memory in in this situation they can't do this experience sharing with other people, like how they feel with some previous events. And the last one, the lack of flexible creativity thinking or problem solving, which is quite illustrate. So, what shall we do to fix all these five core deficits? Of course, in RDI we introduced this idea of mindful guiding, and who should play the role of this guiding? Of course, it's a parent's role. No one else uh, subs, can substitute this from parents. Teachers can't do this. Occupational therapists can't do this. Doctors can do this. Only parents, because parents are the ones who know their children the best, and they spend most of their time with their children. And speaking of this mindful guiding, identifying the cause of autism related appearance is very important. As parents, we should looking for which part is caused by lack of guiding, and which part of the children's problem or deficits we say here is because of their own self deficits. And through mindful guiding we can fix this part, and we for other part of the deficits, maybe pronunciation or maybe attentions, we can looking for some specialists like OT, PT, or specialist to fix this part of the deficits.